Today, we will discuss persistent fevers in infants. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. What is it? A fever in a baby is when their body temperature is higher than normal. For infants under 3 months, a fever is usually defined as a temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher. Persistent fever means it lasts for an extended period, which can be a sign of infection or illness. How to know if your child has a fever. Check the temperature. Use a digital thermometer to measure your baby's temperature. You can do this rectally for the most accurate reading or under the armpit for a quick check. Feel their body. If your baby feels unusually warm to the touch, especially on their forehead, this could indicate a fever. Look for other signs: increased fussiness or irritability, poor feeding or lack of interest in eating, lethargy, seeming unusually sleepy or inactive, sweating or chills. When to seek help. If your baby has a fever of 100.4 degrees Fahrenheit, 38 degrees or higher, especially if it lasts more than a few hours, contact your pediatrician right away. If your baby is less responsive or has difficulty breathing, get medical help immediately. Conclusion: a persistent fever in a young infant can be serious, so it's important to monitor their symptoms closely and consult with a healthcare provider if you're concerned. If an infant has a persistent fever, especially a baby under 3 months old, here's what to do in simple steps. Check temperature. Use a thermometer to see if it's 100.4 degrees Fahrenheit or higher. Keep them comfortable. Dress them in light clothing and keep the room cool. Hydrate. Make sure they drink enough fluids like breast milk, formula, or water for older kids. Monitor symptoms. Watch for any changes like fussiness or trouble breathing. Give medicine if needed. If the doctor says it's okay, you can give fever-reducing medicine like acetaminophen, Tylenol for babies over 2 months. Call the doctor. If the fever lasts more than a few hours, or if you are worried, contact a healthcare provider right away. Stay calm. Keep calm and comfort the person. Your support helps. In the hospital, if someone has a persistent fever, here's what the medical team typically does in simple terms. Check vital signs. They measure temperature, heart rate, breathing, and blood pressure to see how the person is doing. Ask questions. They'll ask about symptoms, when the fever started, and any other health issues. Run tests. They may do blood tests or other tests like urine tests or imaging to find out what's causing the fever. Administer fluids. If the person is dehydrated, they might give fluids through an IV, a tube in the arm. Give medicine. They may provide fever-reducing medicine or antibiotics if there's an infection. Monitor closely. They keep a close watch on the person to see if they improve or if more treatment is needed. Provide support. They'll offer comfort and support to help the person feel better. The goal is to find the cause of the fever and treat it effectively. For treating a persistent fever, especially in infants and children, here are some commonly used medications. Acetaminophen, Tylenol, often used to reduce fever and relieve pain. Safe for infants over 2 months old. Ibuprofen, Motrin, another option for reducing fever and pain. Suitable for children over 6 months old. If a bacterial infection is suspected, doctors may prescribe antibiotics like. These are not used for viral infections. Important note: always consult a healthcare provider before giving any medication to infants or young children to ensure it's appropriate for their age and condition. Some babies and young children are more likely to develop a persistent fever due to various reasons. Here are the groups at increased risk. Very young infants. Babies under 3 months old are more vulnerable because their immune systems are still developing. Premature babies. Babies born early may have weaker immune systems and be more prone to infections. Babies with existing health issues. Those with conditions like heart problems, lung issues, or weakened immune systems are at higher risk. Exposure to sick people. If a baby is around someone who is sick, they are more likely to catch infections. Not vaccinated. Babies who haven't received their vaccinations may be at greater risk for certain illnesses that can cause fever. Living in crowded places. Being in close quarters with many people can increase the chance of spreading germs. These factors can make it easier for infections to develop, leading to a persistent fever. Now you need to watch my video on hyponatremia or have a look at otitis media.